Good afternoon, everyone. Myself, Dr. Sugandha Agarwal, Department of Public Health Dentistry Department, Babu Banarsidass College of Dental Sciences. Today, we'll be taking a lecture on level of prevention. Contents: Introduction, Level of Prevention, Modes of Intervention, Prevention of Common Oral Disease. Prevention. What is prevention? Prevention is the action aimed at eradicating, eliminating, or minimizing the impact of disease and disability, or if none of these are feasible, retarding the progress of disability and disease. So, first is the primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Modes of intervention. Intervention is any attempt to intervene or interrupt the usual sequence in the development of disease in man. Primordial prevention is the prevention of the risk factors in population groups in which they have not yet appeared. Efforts are directed towards discouraging children from adopting harmful lifestyle. The main intervention is through individual and mass education. Examples: national policies and programs on nutrition involving the agriculture sector, the food industry, and food import export sector, comprehensive policies to discourage smoking, programs to promote regular physical activity, making major changes in lifestyle. Primary prevention, defined as action taken prior to the onset of disease, which removes the possibility that a disease will ever occur. It envisages the concept of positive health based on the elimination or modification of risk factors of disease. The following approaches are recommended by the WHO for the primary prevention of chronic disease. First is population mass strategy. This is directed towards the socioeconomic, behavioral, and lifestyle changes. High risk strategy, detection of individuals at high risk by the optimum use of clinical method. Secondary prevention, defined as action which halts the progress of disease at its incipient stage and prevents complication, aims to arrest the disease process, restore health by seeking out unrecognized disease and treating it out before irreversible changes take place. Reverse communicability of the infectious disease. Disadvantage: patient has already been subjected to mental anguish, physical pain, loss of productivity, expensive, less effective than the primary prevention. Tertiary prevention, defined as all measures available to reduce or limit impairments and disability, minimize suffering caused by existing departures from the good health, and to promote the patient adjustment to irremediable conditions. It extends the concept of the prevention into the field and rehabilitation. Primary prevention, first is the health promotion, specific protection. Secondary prevention, early diagnosis and treatment. Tertiary prevention, disability limitation and rehabilitation. Health promotion, defined as the process of enabling people to increase the control over and to improve health. The well-known intervention in this area is health education. You can educate the patient, environmental modification, nutritional intervention, lifestyle and behavioral changes. Specific protection, to avoid disease altogether. Early diagnosis and treatment, it is defined as a detection of the disturbances of homeostatic and compensatory mechanism while biochemical, morphological, and functional changes are still reversible. Though not as effective and economical as primary prevention, but reduces the mortality and morbidity in the certain disease. Mass approach treatment, the rationale is existence of at least 4 to 5 cases of latent infection for each clinical case of active disease in the community. Disability limitation, concept of disability, disease, impairment, disability. Handicap. Impairment. It is defined as any loss or abnormality or psychological, physiological, or anatomical structure or function. Disability defined as any restriction or lack of ability to perform an activity in the manner or within the range considered normal for a human being. Handicap defined as a disadvantage for a given individual resulting from an impairment or a disability that limits or prevents the fulfillment of a role that is normal for that individual. Disability prevention relates to all the level of prevention. First, reducing the level of impairment, that is primary prevention. Disability limitation, that is secondary prevention. Preventing the transition of disability into the handicap, that is tertiary prevention. Rehabilitation, it is defined as a combined and coordinated use of medical, social, educational, and vocational measures for training and retraining that individual to the highest possible level of functioning. Level of prevention for the dental caries. Service provided by the individual, there is health promotion. You can Tell the patient about the diet planning, demand for preventive services, periodic visit to the dental office. Specific protection, appropriate use of fluoride, ingestion of sufficient fluoridated water, appropriate use of fluoride prescriptions, use of fluoride dentifrice, oral hygiene practices. Early diagnosis and treatment, self-examination and referral, use of dental services, disability limitation and rehabilitation, use of dental services. Services provided by the community, health promotion, dental health education programs, promotion of research efforts and lobby efforts, specific protection with community or school water fluoridation, school mouth rinse and tablet program, school sealant program. Early diagnosis and treatment, that is periodic screening and referral, provision of the dental services, disability limitation or rehabilitation, the provision of dental services. Services provided by the dental professionals, health promotion, patient education, plaque control program, diet counseling, recall reinforcement, and dental caries activity test. Specific protection, topical application of fluoride, fluoride supplements, or rinse prescriptions, pit and fissure sealants. Early diagnosis and treatment, complete examination, prompt treatment of incipient lesions, preventive restoration, simple restorative dentistry, pulp capping. Disability limitation, complex restorative dentistry, pulpotomy, root canal therapy, extraction, rehabilitation, removal and fixed prosthodontics, minor tooth movement, implants. Level of prevention for oral cancer. Services provided by the individual, that is health promotion, periodic visit to the dental office, demand for the preventive services, specific protection, avoidance of the known irritants. Early diagnosis and treatment, self-examination, referral, use of dental services, disability limitation, rehabilitation, use of dental services. Services provided by the community, health promotion is very necessary, dental health education program, promotion of research efforts, provision of oral hygiene aids and lobby efforts, specific protection, demand for legislation to ban tobacco and its product. Early diagnosis and treatment, periodic screening and referral, provision of dental services, disability limitation, rehabilitation, provision of dental services. Services provided by the dental professionals, health promotion, patient education is must, exhibiting to no smoking signs in the clinic, do not provide any ashtrays, strike down the advertisement of tobacco products in newspaper and magazines, specific protection, removal of known irritants in oral cavity. Early diagnosis and treatment, complete examination, biopsy, oral cytology, and complete excision, disability limitation, chemotherapy, radiation therapy, and surgery. Rehabilitation, maxillofacial and removal prosthodontics, plastic surgery, speech therapy, and counseling. So this is the last. Prevention is better than cure. Thank you.